Everyone. So in the recent COVID-19 numbers, specifically yesterday, there was a particular event which is a good illustration of how seeing the numbers from first glance can paint a different picture than when you look deeper into the numbers. So what was the big news yesterday is if you look at Canada's number of active cases each day during the coronavirus spread going on, there's a very good graph on Wikipedia, which is on the edge of the screen right here, and they update it daily. And so along the vertical axis you have date, and then you have colored bars representing active cases in orange, and then recoveries in blue and deaths in black. So as the days progress, as I scroll down, what jumps out is the orange bars are growing exponentially as expected. And then on March 23rd, you see a bar much, much higher going out of the trend, right? And this was on the news. People were saying that this is a big unexpected growth. Okay, so it looks scary from first glance. Now, this is certainly a serious situation, but the height of that bar is misleading, and you can see why if you look deeper into the numbers. Now on this very same page, again, it's a good resource, lots of detail, updated daily. You see the numbers per province if you scroll down to the bottom. And there we have it. In this bottom corner right here, you have the number of cases per province. And you see, as you get to March 23rd, there's a big jump for the numbers in Quebec. But for the other provinces, okay, and other regions, they seem to be following the same exponential trend as the country in total. So what happened in Quebec? Was there a spike in coronavirus cases in Quebec? Now again, a graph is an illustration of the numbers, okay? But to get the raw data, you look at the actual numbers. And if you scroll up, we can see that. For March 23rd, we see the number of cases for Ontario in this column, for Quebec in this column, and other columns are other provinces. So if we scroll up, you see that, Ontario and Quebec. And what's going on? You see that big jump for Quebec, 38 to 409. Now for Ontario, things seem to follow a typical trend. 60, 59, it's about the same. 48, a bit lower. 78, higher. 85, a bit higher. This is midday. That number might grow somewhat. But this is incomparable to what's going on from 38 to 409 in Quebec. Now you see there's a note here, which brings us to this sentence there, okay? On March 23rd, Quebec announced that this large increase is due to new acceptance of tests by hospital center laboratories without requiring confirmation by the Quebec Public Health Laboratory, okay? So what happened was Quebec started measuring their numbers differently, okay? So before, Quebec only reported numbers that were confirmed by the Quebec Public Health Laboratory. Whereas what happened on March 23rd, they changed their acceptance criteria and started reporting cases that were results of tests at hospital center laboratories. So that's what made the number go higher. They started recording the numbers differently. Previously, the numbers represented cases confirmed by the Public Health Laboratory, and as of March 23rd, the number represents test results from hospital center laboratories. They are measuring something else, okay? The numbers before March 23rd are measuring something different than the numbers after March 23rd in Quebec. So when you see that jump, this is as if they're measuring temperature, and they changed their scale from measuring in Celsius to measuring in Fahrenheit. Now, if you were measuring temperature each day, and you were to change your scale like that one day, well then your temperature reading would suddenly go way up. But does that mean that the temperature increased? No, the temperature did not increase to the extent to which the graph would suggest that it increased if you put Fahrenheit and Celsius on the same scale. Okay, so let's say it went from 25 degrees to 26 degrees Celsius, but the second time, instead of in Celsius, you measured it in Fahrenheit, you'd see a number in the 20s, and then next day it would be a number in the 70s, which is misleading with regards to how much the temperature actually increased. The trend in Quebec is probably the same as it was before. It just looks like a break in the trend. It looks like a higher number because what is being measured is different. What is being measured is not only those results that were confirmed by, we have the name here, Quebec Public Health Laboratory, but instead it's measuring the test results from hospital central laboratories. That's why that Quebec number is much higher. While the other provinces, they look like they're following the same trend. And that's what affects, if you look at this graph here in the other bottom corner, this is number of cases in Canada. You see that big jump? That big jump is because Quebec changed what they're measuring. Okay? In the top left corner here, you have new cases per day, March 23rd. It's way out of trend, again, because Quebec changed what it is they're measuring. That's why the number looks so different. The trend is probably the same. Okay? Now, you can ask yourself a few questions. For example, well, what if Quebec's new numbers are higher? If they were measuring in this new method before, then the numbers would have always been higher. Okay? If the other provinces were measuring differently, their numbers would have also been higher. So, sure, the situation unfolding, the trend didn't change, but does this information from Quebec tell us that the numbers are actually higher than we think they are? Well, first off, we already knew the numbers were higher than we think they are because the results are only those people who are tested. There's people who have some symptoms who are not tested. There's people who don't have any symptoms, yet they are carrying the disease and they weren't tested for that reason. But it is okay if our numbers are off as long as we know by how much they are off. Okay, if you know that your thermometer always is off by 10 degrees, say it's 10 degrees higher all the time, then that's fine. You can use that thermometer and get reliable information. And what's important is the trend, right? So whether we're using Quebec's method of measurement or whether we're using Quebec's previous method of measurement, the other provinces' methods of measurement, as long as we stick to the same method, we can see the trend. And from the trend, we can make certain predictions. Now, what are those predictions? Well, if you look at what's happening on Canada's new cases approaching March 23rd, we see a steady rise. This is the top left graph, an exponential rise, and then it drops, then it kind of continues rising, and then you see another drop. Okay, now this is good news, okay, that the new cases are not consistently rising exponentially, that there is a certain factor here dropping it. And what you see with the spread of disease is it begins as an exponential curve, and then the total number of cases becomes linear and then eventually flattens out. Now, an excellent example is looking at the numbers from South Korea. South Korea so far has done an excellent job fighting off the spread of this disease. Now, if we look at their numbers, again, this is through Wikipedia. We see those orange bars increasing exponentially as the dates go on, and then it becomes more linear, and then it flattens out. Okay? Now, the orange bars are representing the number of active cases, right? So it flattening out means that the growth of active cases is decreasing, but those orange bars are actually getting shorter because you have these blue bars here, and the blue bars are representing recoveries. Okay? As people start recovering, the number of active cases decreases. Okay? It's no longer an active case if someone has recovered. So a very good indicator of these active cases decreasing their growth rate and flattening out is when you see the recovery rate increase. This is that blue bar. You see it's barely visible, then it starts increasing significantly, and it grows and grows and grows, And with time, if things continue to go well, those blue bars will continue to get higher and higher, and the orange bars will get lower and lower. Okay? Now, if you look at these orange bars here, this is without the blue bars making them seem higher than they actually are. This is just the number of active cases. So you see they're rising exponentially, they become more linear, then they flatten out, and then it starts decreasing. Okay, you have less and less active cases as more and more people recover, and less people are getting sick, which means there's less new cases. Less new people are getting sick to push those orange bars up. Now, if you look at the number of new cases in South Korea, that's exactly what happens. It grows exponentially and then it drops off, and you have fairly small number of new cases per day after March 10th, whereas you have a lot of recoveries per day, more recoveries per day after March 10th to counter the new cases happening, and that's why the active cases, the orange bars, are getting shorter. That's what we see here. The active cases, the orange bars, are getting shorter. When we look at Canada's numbers, if we handle things well, like South Korea did, then we can expect the same trend. So one thing to notice from those same numbers from March 23rd, and I'm going to scroll back up to that original graph, is look at that big orange bar. Okay, this is the number of recoveries. It jumped up. That's a good sign. Okay, the number of recoveries jumping up is an indicator that we may be approaching that stage where the number of active cases starts decreasing its rate of growth and eventually flattens out and actually starts decreasing in number. Okay, that's an indicator that we're getting there. Another indicator that we're getting there is that this exponential growth of the active cases seems to be getting linear if we discount the cases in Quebec jumping, not because the trend changed, but because what was being measured changed, right? So we'd already talked about how this large orange bar here is misleading. So if we ignore that large orange bar, we look at the cases for the rest of Canada before March 23rd. When we look at cases for the other provinces, it looks like that exponential curve for Ontario, to an extent for British Columbia, maybe Alberta, it seems to be flattening out, even for Quebec before the 23rd. Sorry, not flattening out, but becoming more linear, which is another sign that it could be flattening out soon. When we look at number of new cases per day, it's still growing, but it did drop twice in the last few days. It seems to be growing not so much exponentially, but more linearly. And again, that's another good sign that we could be approaching the situation where the rate of growth of cases is decreasing, which eventually leads to a decrease in total number of cases as more people recover, right? Now, this doesn't mean that Quebec's numbers are not reliable anymore. It just means that we have to stick to the same measurement method to look at a trend. So when we look at Quebec's numbers before the 23rd, that's a trend. When we look at Quebec's numbers after the 23rd, that's a trend as well. Okay? Now when we look at Quebec's numbers for the 24th, it's 385. It went from 409 to 385. Okay? These are Quebec's cases. Now, again, this is still half the day. That number might grow, but it is a good sign and an expected sign that we don't see a jump from the 23rd to the 24th like we saw from the 22nd to the 23rd. Again, because 22nd to the 23rd is a misleading jump because what is being measured changed, whereas from the 23rd to the 24th should be following the same trend. Okay? And that's what we see without that shocking jump and with the number of recoveries. Now if we go here, we see the number of recoveries, new recoveries and cumulative recoveries. From the 22nd to the 23rd, we went from 2 new recoveries to 94. Total recoveries went from 18 to 112. Another very good sign. Now all of this information, right, positive information, it doesn't mean that everything is good. It's still a very serious situation, and these good signs is not something that would suggest that the measures to decrease the spread of the disease, like quarantine, social distancing, and all that, it does not suggest that these measures are not needed anymore. On the contrary, it means that these measures are needed because it suggests that these measures are working. Okay? And if they're working, then we need to keep doing them so that they keep working. Otherwise, they will stop working. And we talked about South Korea's success story, where we have number of active cases dropping. Okay? That's because South Korea implemented a lot of measures, some measures that have not been implemented here, and these measures were working. Okay? So it's important to keep doing that, right? And again, the general theme is when you first look at the numbers, the first thing that jumps out at you is, I'm scrolling up to that very first graph, look at that huge orange bar. It's so much bigger than before. That's scary. It's spreading so much faster. That's the first thing that jumps out. But you look at the numbers a little closer and you see that, well, that orange bar, how much higher it is, it's misleading because part of that orange bar comes from Quebec's cases, which are actually measuring something different than what they were measuring on March 22nd and earlier. And what we don't see is that huge jump in the recoveries, okay? And that's a very good sign, that jump in recoveries.